The big advantage to radiation is the avoidance of surgery. You know, many patients have this fear of going under anesthesia and having surgery. Outpatient radiation goes Monday through Friday for 8 weeks. Generally, the patients in the radiation department an average of 20 to 60 minutes. They have a specified time of their visit, and they get in and out, and they can get on with their daily activities, and eventually radiation will be completed. Unlike surgery, with radiation, the PSA value falls very slowly and takes about 1 to 2 years to reach its nadir, or its low point, and it almost never reaches an undetectable level. Now, there are some techniques combining radiation with hormonal therapy, and in those instances, the PSA will be lowered by the hormonal medicine to an undetectable level, and then the observation is to see whether the radiation can maintain the PSA at that undetectable level in the years following the completion of radiation therapy.
Saw Dr. Urban and discussed everything with him, and the thing I was surprised, he wasn't adamant about doing it this way or that way. He said, you know, here's your options. Surgery really wasn't an option, he said, but if you insist, I'll do it. And I got to thinking, and my wife and myself both, why did I drive up here if I'm not going to listen to the man? So we opted for the hormone and radiation. Well, with a Gleason score of 9, the margin between the good tissue and the cancerous tissue was too narrow to ensure that he was going to get everything out of there. And he said, I'm going to have to radiate you probably afterwards anyway, so why should we bother carving you up, if you will? We can get pretty much the same result using the hormone therapy. And it's okay. That to me was a no-brainer. In my case, it's 8 weeks, 5 days a week, so there's 40 treatments. Painless, really. I mean, there's nothing to it. Later on, if it does indeed show that the thing had gotten out, and this may be a year, 2 years down the road, then they've been prescribing the hormone, the chemo. And I think the thinking is, well, maybe on the front end, maybe if some of those little guys did get outside, we can get them before they go and roost somewhere else and start multiplying. And so that was the thinking. And I asked Dr. Vivash, I said, well, what would you do? Put him on the spot. And he said, you got nothing to lose and everything to gain.